So in part three, I wanted to just quickly outline what it's like for the dad who, transitions into parenthood. Surprise. Now, I do think we tell men about sleeplessness. That's one of the things that is a common point of, conversation, but we don't tell them much about postnatal depletion. They're probably not aware of matrescence and just how much they and their partner will change after a new child is born. Mental health, we're trying to, tell men about that now, but at least half of men don't realize that they can have it themselves. Financial stress, it's hard to, share about financial stress because it's such a, I guess, a personal kind of problem, and we don't want to be kind of sharing much about that. But fathers do feel, not all of them obviously, but fathers feel that there might be financial stress. How do I look after my family? Fathers and bonding opportunities, they might not have as much time with their child, so the bonding opportunities are not as, as prevalent. And one way of looking at it, I think, is a good analogy, is that early fatherhood is a lot like surfing, in the sense that there's a lot of paddling, but there's very few waves. Mums get a lot of the waves and do a lot of the paddling, but men don't really get many waves. In that first year, it's tough, and we have to kind of recognize that and begin to transfer that knowledge to men so that they don't come into it blind. They need to adapt to parenting styles, their own. What's their style in comparison to their partner? How do they negotiate those parenting styles to be, the most effective team that they possibly can be? They have to adapt themselves to childcare, caring for a child. It's not an easy adaptation. Their relationship grief, they will miss their partner, they'll miss the intimacy, they feel abandoned. Often men feel a little abandoned, and we don't really brief them about that. We need to tell them more about the fact that they're going to feel like they're, coming third, they're an ATM, they're not important, that kind of thing. So I think if we give them an idea and a heads up that that's actually going to happen, we might be in a better place. But of course, let's recognize perhaps your perspective. And I don't know the dynamics of your own kind of work environment, so take this with a grain of salt if you like. But I think when it comes to maternity care and perinatal health, the system necessitates the women focus because of resourcing, the training, the workforce training and development, the policy models of care. It's all geared towards mum, and necessarily, and that's fine. I think my work is about trying to carve out a little bit of room for dad. And there's also a variance in the dad-leaning culture among midwives and health professionals. So some people care about and want to help dads, others see them a bit more of a hindrance. And yeah, both of those perspectives are valid, obviously. And how do you assess someone's awareness or willingness to learn? And, interpersonal skills dictate that we can't always connect with everyone. And, so those are some of the issues that I find, with your own perspective. There might be knowledge gaps for dads as well. And you may give him a little bit of information about X subject, and he may ask you something about Y, and you might not have the time to engage. So fully understand these aspects of and challenges for yourselves going forward. But how do we accelerate this transition in a sense of trying to engage dads and, employ dads' help sometimes? One of the things is to recognize that birth is women's business and men's business in 2023. Like I said, over 95% of births are attended by men now. So we need to actually recognize that they're involved and, employ their assistants. And we need a heap of resources to from all different organizations, so that dads see themselves in perinatal health everywhere they go, top-down support, which is like political will. And we need to fix the breakdown in the socio-cultural evolutionary process. A bit of a mouthful, but normally when we are evolving in our cultural or social kind of aspects of our communities, what happens is people talk with each other about it. We talk about the way that things are changing. What do we think about it? Do you like it? And so that doesn't occur with men at the moment. We're not really communicating perinatal health wisdom between each other. We're going through it and hopefully communicating it to our children in 25 years' time. But, at the moment, we're not really doing that. And the way to accelerate this process is to actually define dad's role in the perinatal period and then publicize it and let them know, so that they can actually begin to share that with each other. And it might raise the profile of the dad at birth, pregnancy support and those crucial early days. Because we need to take dads from a place of fear to a place of love when it comes to all of this, perinatal child rearing type of childbirth and child rearing. We need to take them from this apprehensive, mysterious place of indifference to a place where they've got willingness and confidence and knowledge and real skills that they can actually begin to help their partners with the birth of their children. We need to take them from being a helpless witness to where they can provide meaningful support. So perhaps consider going forward that dads are a co-parent. They're an equal co-parent. And a lot of them actually are identifying as that now. So if you make that assumption, you're going to be right a fair bit of the time. Obviously, you're going to be wrong sometimes, but just recognize that dads love their family as well. I mean, with the high publicity of some, unfortunate events in our society around domestic violence, family violence, it's easy to think that maybe some men don't love their families, and that seems to be true. But I think if we assume that, that's not the norm, we can assume that dads, they really love their families too. So try and have a teamwork ethos about the couple as well, because that's the best case scenario if they work as a team. And if there's something going on, if there's been a hemorrhage, there's a lot of possible scenarios where he may need situational updates. What's happening? One of the things that men tell me that is tough for them in the maternity care kind of space is if something happens to their partner or their baby, then they're not being briefed, they're not being told, they're not being kind of kept up with the situation. And even if it's just a little bit of recognition while you're passing, it's a simple kind of, hey mate, how you doing? We're doing our best. I'll come back when I know if something's changed. That's just, the slightest little thing that you could do to help that man kind of get through this time a little more smoothly. And I think the future of childbirth can look like this if we involve fathers throughout pregnancy, so that we can actually give them a heads up about their importance and what they can do to help. And this could be the future of birth. And I sure hope it is like this. A few resources that you might be interested in checking out is the Birthing Dads program, which I developed. It's a couple of video series and some other resources. There's SMS for Dads, which is a regular update via SMS from the perspective of the child often, which is kind of cute. And then there's Ready to Cope, which is an email. And I think they've actually got an app now as well. And that's from the Centre of Perinatal Excellence. Here's a few of my references. I'd be interested in talking to you if you ever want to reach out and talk to me about this topic, because I really enjoy talking about this topic. But thank you for listening, and I wish you well on the rest of this course. Thank you. Bye-bye.